One thing we all know about signing up for healthcare is it can be confusing, right? Especially when it comes to Medicare. So finding someone who specializes in those plans is a must when it comes to enrolling for 2017. So we have agent Lucy Gross, who is the owner of Alta Vista Benefits, here with more. So nice to meet you, Lucy.
Thank you. Same to you.
So let's first talk about the deadline, the Medicare deadline. What do people need to know, keep in the back of their minds?
Okay, well, they have until December 7th to make a decision about plans for 2017. And if they have not chosen a drug plan or a Medicare Advantage plan and their drugs have changed or they have not reviewed them, it's very important to do that between now and December 7th.
Okay, so it's coming, December 7th, not that far away. So you're an independent insurance agent. As I mentioned, Alta Vista Benefits, the name of your company. Tell me a little about it and what you can offer people.
Well, I started my agency in 2007. As an independent agent, I represent all the different carriers, so people have a choice, and that's really a benefit to consumers because if you have an independent agent, they look at all the different choices and help you find what's right for you.
Okay, and Lucy, I mentioned Medicare. It's a specialty. Why is that so important when choosing an advisor like yourself?
Well, if you work with an advisor who doesn't specialize in Medicare, Medicare is changing rapidly, and it's very important that you work with somebody who does that all the time so that they're knowledgeable about the plans that are available and about the coverage that's available, so it helps them make the right choices.
And you and I were talking about some of the things that people don't realize when it comes to Medicare. First and foremost, it doesn't cover everything.
That's right. Let me give you a couple of examples. Medicare does not cover long-term care, and a lot of people get caught short on that. It only covers skilled nursing up to 100 days, and even 100 days can be limited if somebody says, if the doctor says to the person, you're stable, then Medicare stops paying. But the biggest thing that people get caught on is observation. So if they go to the emergency room and the doctor says, we want to keep you for observation, you should say, no, I'm either sick enough to admit or I'm out of here.
Okay, and you need to know that before you get there, obviously. That's the important part. Okay, and you don't just help people pick plans. As we mentioned, a lot of this is about education.
Absolutely. I go through all of the Medicare materials with people and show them what the types of choices are that they have, what the financial decision is in addition to what the health insurance decision is, because it's actually both. So you're making a financial decision and you're making a health care decision. And you have to decide what's in your budget, you know, what relates to you from a health perspective and that sort of thing.
What about billing? I think that's probably one of the areas that people find maybe the most confusing or the most frustrating when they get billing. So how can you help educate them on that?
Well, Ohio is not a balanced bill state, and what I mean by that is that hospitals and doctors are not allowed to bill you beyond what your insurance covers. So a lot of people don't know that, and I get involved in the billing to help them figure out whether or not something is a balanced bill and they truly owe it or not owe it.
Okay, and that can be very frustrating when they get a bill in the mail. They see that big number and think, oh my goodness, you know, I had no idea. The other thing you mentioned is that when Medicare doesn't cover something, can you rely on your insurance then to cover it? I know a lot of people have multiple plans going on.
No, you can't. If Medicare is the overriding control, and if Medicare says a service is not covered, it doesn't matter what insurance you have, it won't cover the service either.
We have a warning too today for people out there. Cold calls, which we hate receiving anyways.
Right.
If you're in Ohio and you're getting calls, hey, I can hook you up with this Medicare plan or this or that or the other, you're saying that's actually an illegal activity.
That's correct. A couple years ago, and I'm not sure of the exact date, but the state of Ohio passed legislation that made agents follow the same rules for Medicare Advantage and Part D plans, marketing rules that CMS has established for those two products. And the legislation now covers you for Medicare supplements as well. And it used to be that agents could call on Medicare supplements without having a problem, but now that's not true. The biggest problem is agents that are calling from the state of Florida, and they're calling into the state of Ohio.
Okay, so be wary of that.
That's right.
Be aware. If somebody calls you today, Lucy, what can they expect from a meeting with you?
Well, they can expect to understand their choices and have an advocate on their side rather than somebody who is totally for the insurance companies. Obviously, I represent the insurance companies, and I do that with a reputable company, but I'm going to educate them to make sure that they understand what they're buying, they understand how much it's going to cost, and when they go to the doctor, how much it's going to cost.
Okay, all important things.
Absolutely.
So Lucy Gross with Alta Vista Benefits. We have the information on screen, the website, as well as the phone number. So thanks for being here, Lucy.
Thank you.